Hi, and welcome to this evening's VCU Health virtual seminar on cancer survivorship and how people are living long and productive lives after a cancer diagnosis through planning, communication, and attention to a broad scope of health factors. My name is Blake Belden, and I'm a member of the marketing and communications team at VCU Massey Cancer Center. Tonight, we're joined by Dr. Susan Hong, Director of the Cancer Survivorship Program at Massey Cancer Center. She will discuss how an integrated survivorship program enhances patient-centered cancer care and ensures quality long-term health management. Before we begin the presentation, I would like to just make note that we'll hold any questions until the end, but feel free to drop any questions you have in the Facebook comment section throughout the event, and we'll address them during the Q&A portion at the end. Dr. Susan Hong joined Massey and VCU Health in January as the director of the Cancer Survivorship Program. As director, she works with hospital and cancer center leadership, clinicians, subspecialists, and primary care colleagues in building a robust cancer survivorship program and clinic at Massey. She also holds the RGC Professorship in Cancer Research and is an associate professor in the Division of Hematology, Oncology, and Palliative Care at the VCU School of Medicine. Hong develops and employs a comprehensive set of initiatives to address the medical needs of cancer survivors and collaborate directly with colleagues throughout the university and health system who have a focus on survivorship care and research. Thank you so much, Dr. Hong, for joining us today. I'll now turn the show over to you.
Thank you. Good evening. I'm Dr. Susan Hong, Director of the VCU Program. According to the National Cancer Institute, an individual is considered a cancer survivor from the time of their diagnosis through the balance of his or her life. And because family members, friends, and caregivers are impacted by a cancer diagnosis, they're included in the definition. Caregivers are sometimes referred to as secondary survivors. In 1975, there were a little over 3.5 million cancer survivors. Today, that figure exceeds 18 million. And by 2040, there'll be over 26 million Americans who can call themselves cancer survivors. Cancer is no longer a death sentence. So a person diagnosed with cancer today has a good prognosis. 67% of individuals are expected to live 5 or more years past their diagnosis, 45% 10 or more years past their diagnosis, and 18% and growing will live 20 or more years past their cancer diagnosis. So what are the cancers involved? So breast cancer survivors make up the largest group, about 22 to 23%. This is followed by prostate and colorectal, and the three together make up more than 50% of all cancer survivors. And yet, despite the significant progress we've made in cancer care, we know that there are some very significant long-term negative health consequences. With decades of research, we're able to quantify some of those negative consequences. So the initial studies were done in the pediatric population. The Childhood Cancer Survivorship Study was a retrospective cohort study, and it's still ongoing, that enrolled adult survivors of childhood cancer. The initial cohort was enrolled across the US and Canada at 26 centers, and they were followed for the long-term negative health consequences. The cohort was compared to their siblings. And so compared to their siblings, childhood cancer survivors had higher rates of health problems, were less likely to complete high school, had much higher rates of serious health diseases such as heart failure, kidney disease, and heart disease. And what was surprising was that treatment-related complications were being seen more than 25 years out. And in fact, having a history of childhood cancer increased your risk of developing a chronic health problem. So by 30 years post-treatment completion, 70% had at least one chronic health condition, and 32% had multiple health problems. So fortunately, 1% of all cancers are diagnosed in the pediatric population. The vast majority of cancers are diagnosed in adults. 60% of all cancers are diagnosed in individuals over the age of 64 years. But with decades of research, we know that adults suffer as well. And we know that there are significant long-term negative health consequences for adult cancer survivors. Survey studies on quality of life show that at least a third of long-term cancer survivors report some degree of chronic pain. Since 40% of adults are still within working age when they're diagnosed with cancer, studies on how a cancer diagnosis impacts employment demonstrate that almost half of women and over a third of men have had to make adjustments to their employment status. In this country, bankruptcies due to medical debt are the number one cause of personal bankruptcies, so 62%. A cancer survivor has an increased risk of declaring bankruptcy compared to somebody without a history of cancer, on the order of 2.5 times more likely. And so when we look at the long-term consequences for adults, we see that adult survivors have higher rates of anxiety and depression. Certainly they have real risk for a second primary cancer, and there's concern about the risk for recurrence. Adult survivors report greater problems with physical functioning, cognitive functioning, and not surprisingly, because of this, report poor overall quality of life. So remember, the title of this talk is Survivorship Care, a holistic approach to comprehensive cancer care. How can survivorship care reduce the negative impacts of cancer and cancer treatments? In 2005, the Institute of Medicine, which is now called the National Academy of Medicine, Sciences, and Engineering, published a 560-page report entitled From Cancer Patient to Cancer Survivor, Lost in Transition. In this report, they detailed the significant negative consequences of a cancer diagnosis and all the health issues that are experienced by cancer survivors, not only in the US, but across the world. But they also made some very important recommendations to mitigate some of these negative consequences. And one of the most important recommendations was the delivery of survivorship care. So I want to go over the 4 essential components of survivorship care as outlined by the Institute of Medicine. First is the prevention of recurrent and new cancers and other late effects. Second, the surveillance for cancer spread, recurrence, or second cancers, as well as the assessment of medical and psychosocial late effects. Third, the intervention for the consequences of cancer and its treatment. And 4 is the coordination of care between specialists and primary care provider to ensure that all aspects of a survivor's health needs are being met. So how does the VCU Massey Cancer Survivorship Program address the essential components of survivorship care? Well, I think it's summarized in this phrase: survivorship begins at diagnosis. So I want to talk about how this definition of survivorship really meets the 4 essential components of survivorship care. So the first component, prevention of recurrent and new cancers and other late effects. By treating individuals as early as the time of diagnosis as cancer survivors and really incorporating a holistic view of survivorship care, we're able to reinforce the importance of a healthy lifestyle. We're also able to assess individuals for other risk factors, including their family history. Patients can also be evaluated and, if needed, have their chronic disease managed. And many chronic conditions, such as hypertension and diabetes, can actually increase a person's risk for long-term treatment-related toxicities. The second component, surveillance for cancer spread, recurrence, or second cancers, as well as the assessment of medical and psychosocial late effects. We know that there are significant negative psychosocial impacts from a cancer and cancer treatment. And our goal is to not treat things after the fact, but to try to minimize the late effects. And so by engaging patients as early as the time of diagnosis, we can be proactive and not reactive in our care. Third, regarding the intervention for the consequences of cancer and its treatment. By evaluating patients as early as possible, we can refer individuals to needed supportive services that will optimize health and well-being. For example, a woman of reproductive age who is interested in having children can be referred for fertility preservation services, as well as a man who's interested in preserving his fertility. Patients who receive radiation often experience mobility issues, and they can be referred to physical therapy early so that they can preserve their mobility as much as possible. Women who are undergoing mastectomy, lymph node dissection are at elevated risk for lymphedema, and our goal is not to refer patients once they develop lymphedema, but to have them understand how to prevent the development of lymphedema. And lastly, regarding the coordination of care between specialists and primary care provider to ensure that all aspects of a survivor's health needs are being met. We recognize that many cancer patients either have not seen their primary care physician for quite some time or don't have one. And so the role of the survivorship program is to not only serve as that bridge for people who have PCPs, but sometimes play the role of the comprehensive primary care provider while the patient is trying to establish care with a PCP. And once the patient has a primary care provider, our job is to make sure the care is coordinated, to take care of the areas that the primary care provider and or the cancer specialist feels is outside their scope of practice. So our clinical mission at Massey is to improve the health and well-being of cancer survivors by creating a sustainable and reproducible model of survivorship care that emphasizes prevention and risk reduction, patient empowerment, and care coordination that is accessible for all. But in addition to our clinical care, we have both a research and education mission. Our research mission is to improve the health and well-being of cancer survivors and their families by promoting transdisciplinary, patient-centered research that advances our understanding of the impacts of cancer and cancer treatments. Our education mission is to improve the health and well-being of cancer survivors and their families by educating clinicians and researchers on the importance of patient-centered, comprehensive survivorship care so that we can reduce the long-term negative consequences of cancer and cancer treatments. So who can be seen at the Massey Cancer Survivorship Clinic? Well, anyone with a history of cancer, whether they're treated at VCU Massey or treated elsewhere. They can be seen as early as the time of diagnosis, or they can be many years out. Our goal is to do a comprehensive assessment of all your healthcare needs so that we can make sure that every aspect of the long-term complications of cancers are being addressed. Now I'd like to leave some time for questions.
Thank you so much for that informative presentation, Dr. Hong. As you mentioned, we'll open it up to questions. And before we address any that may have come through on Facebook, I'm going to read a few questions that were submitted in advance. So first, as a cancer survivor, how will my care change now that my treatment is over?
So in terms of the care that we deliver in survivorship care, what we do is very individualized. And so there isn't a cookbook recipe of a plan that needs to be followed for everyone, because every person is unique. They have different circumstances. And so what we do is assess not just your medical issues, but also your social issues, what kinds of services you have access to, what kinds of services you may need access to, so that we can actually tailor what's best for you.
Okay. How can my loved ones and I manage the anxiety or fear about my cancer returning?
So that's a large part of what survivorship care is not only addressing what your fears about cancer recurrence is, but also connecting you to counseling and support services. And so some people need medications, and medications can help, but a lot of times getting peer support can make a big difference. And also understanding the research and the data that people are living longer. And I think seeing providers who really understand survivorship and the trajectory of survivorship can make a big difference.
Okay. So this one is, I'm in remission. Am I at risk for developing a new type of cancer?
So that's a complicated question. We know that cancer survivors have a higher rate of cancer compared to somebody without a previous history of cancer, but it could be because they're just being more, they're undergoing much more surveillance. And so, again, seeing somebody in survivorship, assessing your personal risk, because risk is not just what cancer and what treatments you've had, it's also your genetic predisposition, your lifestyle. And so, we do everything to try to reduce that risk.
Okay. What long-term health issues can I expect because of my cancer and its treatment?
So again, that really depends on the individual. So some people have no problems. Other people have many problems, and it really depends on the cancer that you were diagnosed, the treatments that you received, and how your body reacted to the cancer and the treatments.
Okay. And now, so what type of survivorship programs or support does Massey Cancer Center offer?
So in addition to the clinical service, we have supportive services. We have an integrative medicine program, which does a lot of education and group classes, such as yoga and mindfulness. We have social workers. Massey has a medical legal partnership. So we have lawyers that partner with Massey to provide free legal services for patients on a wide variety of areas. We have an extensive partnership with rehabilitation medicine to offer all different types of services that patients may need. We have dietitians, nutritionists, we have psychologists, and so we have, of course, reproductive endocrinologists, along with many, many other types. And so Massey has pretty much everything that people need.
It's quite a lot of stuff. Let's see, I think here we go. What healthcare professionals are part of the clinic and involved in patient care and survivorship?
So our program, the survivorship program, is very clinical. So I'm a physician. I have a nurse practitioner who has a doctorate in was her doctorate and was, prior to her doctorate, was an oncology nurse. And so because we're so integrated in oncology, it's very, very important that everybody who works in our survivorship clinic understand oncology very well. So it's not just giving you information. It's actually taking care of you clinically is actually a very, very important part of what we do.
Okay. So this one's kind of a two-part question. I want to prevent a recurrence. How can the survivorship program help me? And then on top of that, do you touch on nutrition?
Yeah, and so again, the risk for recurrence is, we assess that based on individual factors. So we look at things like your family history, genetics. We look at the type of cancer you've had, whether you've actually received all the treatments that you needed. Sometimes patients are not able to complete the therapy because they experience treatment-related toxicities, and that might slightly elevate their risk for recurrence. And so we take so many factors into consideration. It's hard to give sort of this one answer, but what we do is constantly monitor patients.
Okay. I think that's it as far as questions coming in. Anything else you'd like to add?
No, I think, my goal is to make sure that everybody has access to these types of services. And so I realize it's not possible for everyone to come to VCU Massey, but if you are getting cancer care, you should ask about the types of survivorship programs, the types of holistic care that you have access to. And it's really important to talk to your cancer specialist about how you can prevent long-term side effects. And it's important to have that discussion early as opposed to waiting until you've completed therapy.
Okay. Well, thank you so much. It was such a pleasure having you join us tonight for this discussion. For those watching, for more information about cancer survivorship, you can follow at VCU Massey Cancer Center on Facebook, or visit Massey at masseycancercenter.org. Once again, thank you so much, Dr. Hong, and to any of us who watched on Facebook, have a great night.
Thank you. Take care.